Good morning, good afternoon, good evening, wherever you're watching this video from. My name is Lola Martins, a member of the Enabler Diaspora Grassroots Support Outreach. I'm here to talk about sickle cell disease. World Sickle Day is observed globally on the 19th of June every year. Sickle cell is a serious condition that affects millions of people all over the world, commonly found in areas where malaria is prevalent. However, due to population movement, sickle cell can be found anywhere in the world. It's a serious condition that affects the red blood cell. It's inherited from both parents. You cannot be infected with sickle cell or catch sickle cell. Sickle cell disorder affects hemoglobin, the part of the blood that carries oxygen around the body. Oxygen is carried less effectively in people with sickle cell, hence sometimes they have sickle cell crisis. Sickle cell affects the quality of the hemoglobin, that is the red cell. The red cell becomes sickle due to lack of oxygen. It becomes stiff and it cannot move properly in the blood vessel. As a result, it blocks the blood vessel, hence it can lead to sickle crisis as well. There are over 1,000 variants of genes. The common ones we know are the AS, AC, AE, SS, and so on. We inherit the genes from our parents. The gene we inherit determines the color of our eyes, our skin, the color of our hair, our height, or the weight. 1 in 5 Africans is an AS carrier, that means the sickle cell carrier. 1 in 10 Afro-Caribbean is a sickle cell carrier. 1 in 20 to 50 Asians are a sickle cell carrier. 1 in 100 Northern Greeks is a sickle cell carrier. Due to population mix, sickle cell is found all over the world. AA is a healthy gene. AS is a sickle carrier. AC is a sickle carrier. AE is a sickle carrier. SS is the sickle cell disease itself. People with sickle cell are susceptible to infection, pain, anemia because their body find it difficult in handling iron, susceptible to stroke, damage to their joints, the hips and their shoulders most especially. They have jaundice, may need treatment for other complications of sickle cell. Sickle cell affects every part of the body: the head, the brain, the heart, the kidney, the eyes, the bones, the chest. Sickle cell affects every part of the body. Available treatment currently is penicillin to be taken twice a day, morning and evening, folic acid to help in producing red cell, hydroxycarbamide is prescribed. People with sickle cell to ensure that their immunization is up to date to prevent infection. Dress accordingly, dress appropriately. Too cold weather can lead to crisis. If the weather is too warm, it can lead to crisis. It is advisable to dress accordingly to prevent sickle cell crisis. People with sickle cell are to maintain a healthy diet, good diet, eat variety of food, nutritious food, drink plenty of fluid, especially water, a lot of water. It helps to flush the system to prevent the sickle from blocking their veins. Carbonated drink is not advisable for people with sickle cell. It doesn't help. Also, strenuous exercise is not advisable. Individual must know their body. They can exercise, but they know when to stop to prevent sickle crisis. Also, regular medical checkup to check their hemoglobin, blood level is advisable as well. Screening is advisable to our young generation. When you are in a relationship and you are planning for the future, ensure that you do your screening, know your genotype, know your partner's genotype, and this will help you to plan for the future, plan for your future generation, and helps to reduce stress or any unwanted disease. There are some myths surrounding sickle cell disease. Some say sickle cell people don't live long. That is not true. With advancement in treatments and medication, sickle cell people live long. I am not sick. I cannot be a sickle cell carrier. I don't manifest anything. I don't have sickle cell crisis. You cannot know unless you carry out the blood test. Do the blood test to ascertain, to know your genotype. That's when you know if you are a sickle cell carrier or not. Because sickle cell carrier don't manifest. Mostly, they don't manifest crises. But for your future, for the planning of the future, because sickle cell carrier and a sickle cell carrier can have sickle cell babies. Oh, I don't want to be infected with sickle cell. You cannot be infected with sickle cell. People inherit sickle cell from their parents, both their parents, that have abnormal sickle cell gene. That is how people get sickle cell. You cannot be infected with it. You cannot catch it. So, on the 19th of June, wear your red to promote sickle cell awareness. Everywhere you go, talks about sickle cell. Speak to people about sickle cell. Let us come together and continue to promote sickle cell awareness.